Hey guys, this is Mike with PhysioU here with your Mentoring Minute. Today we're going to talk about an article from 2013 JOSPT that talks about manual therapy and multimodal treatment for first CMC arthritis, so your thumb arthritis. In this particular study, they looked at patients who were generally older. They were all right hand dominant and had a history of repetitive use of their hand, and they were diagnosed by the hand surgeon as having osteoarthritis. So remember the CMC joint right through here. Here you have the trapezium and the first metacarpal. So we're looking at this joint right in here. So remember, the patients will often complain of pain in this location on the radial side of the wrist. And you can always apply a compression force through the first metacarpal and see if you can reproduce pain in this area. They also did pain pressure thresholds to look for sensitivity. And the way that they managed this problem was with manual therapy, mobilizations, grade 3 MOBs to the first CMC joint, as well as using nerve sliders. And so we're going to just use that, talk about that for a second here with the patient. If you look at the hand here, you can see that here is the thumb, this is the proximal phalange, the first metacarpal, and I know right here is the trapezium. So I'll stabilize the trapezium and apply a grade 1 traction, and then a anterior and posterior grade 3 glides. Okay, so large oscillations. We know that these joint mobilizations seem to have an effect that is very similar to pain analgesic effect, like a manipulation. So that may be some of your improvement in function or pain. But we also think of arthritic changes as mobility deficits. And so when you think about that, adding some traction, some glides may be beneficial. But in this particular study, they did 3 sessions per week for 4 weeks. That's 12 total sessions. They did their mobilizations, and then in supine, they did their nerve sliders. For the nerve glide, the patient was placed in a nerve tension position. We apply a depression to the shoulder girdle, full external rotation of the glenohumeral joint, and I'm going to control the wrist. So as the elbow is extending, I'm going to flex the wrist. And as the elbow flexes, I'm going to extend the wrist. And so this was the nerve glide. This was applied for 5 minutes with a 1-minute rest, and then another 5 minutes, and then a radial nerve slider was applied. So this is the median nerve slider in this case for this particular part of the multimodal treatment. Okay, so for the manual therapy applied, here is the trapezium. This is the first metacarpal here. And so we are going to stabilize the trapezium, apply a grade 1 traction force and an AP glide. So you're doing grade 3 mobilizations for 3 minutes, followed by a 1-minute rest. 3 sets of these 3-minute MOBs were done. So we know that actually from the research that a lot of these mobilizations seem to have a pain analgesic effect, much like manipulation. Granted, with thumb arthritis, we think of this as a mobility deficit. So improving the mobility is one way to improve the patient's pain and disability, but we think that this mobilization itself does reduce the pain and improves the patient's function. So this is the manual therapy component related to mobilization. Next, we'll do the nerve sliders. For the radial nerve slider, we're going to have the patient in a diagonal on the table. We're going to apply a little shoulder girdle depression here. I've got the arm stabilized. And I'm going to put her in the nerve tension position. So elbow extended, wrist flexed, and forearm fully pronated. Now, what I'm going to do is, as the elbow flexes, I'm going to flex the wrist and depress the shoulder girdle. And as the elbow extends, I'm going to release the shoulder girdle and extend the wrist. So you can see this mobilization here. It's almost as though you're compressing everything together. Remember, these nerve mobilizations should be pain-free. They're done for 5 minutes, then there's a 1-minute rest period, and another 5 minutes. The combination of manual therapy with the joint mobilization and the nerve sliders demonstrated improvements in pain and disability. So, in summary, the management of thumb osteoarthritis includes PA glides to the first CMC joint, nerve mobilizations, median nerve mobilizations, as well as radial nerve mobilizations, and a number of different exercises like a tabletop exercise, or large fist to small fist, finger spreading, thumb reaching across the palm and squeezing the ball with a key pinch grip or a tip-to-tip pinch grip. Those different exercises combined improved pain in the patients, but did not necessarily improve pain pressure thresholds or necessarily improve grip strength. All right, I hope that was useful for you guys in treating patients with thumb osteoarthritis. Many of these techniques are built into the PhysioU apps, so make sure you check them out at PhysioU.com.